Home remedy for constipation. Constipation is a common problem. About 20% of Americans are constipated, causing 8 million people to visit doctors' offices annually. Constipation can be caused by food consumption, food abstinence, lifestyle, medication, or disease. The reason for chronic constipation is unknown to most people. Therefore, this type of constipation is called chronic idiopathic constipation. Bowel movements less than 3 times a week are called constipation. However, constipation can be associated with unpleasant symptoms such as discomfort when going to the toilet, bloating and abdominal swelling, and pain caused by dry and dry defecation. Unfortunately, constipation has bad and serious effects on quality of life and physical and mental health. There are natural methods to help relieve symptoms of constipation. You can do these methods easily at home. Most of these methods have been scientifically approved and supported. Taking probiotic foods or probiotic supplements. Probiotics help prevent chronic constipation. In people with chronic constipation, the balance of gut bacteria disappears. Probiotic foods can help keep gut bacteria balanced and prevent constipation. Probiotics help treat constipation by producing lactic acid and short-chain fatty acids. These substances improve bowel movements and make defecation easier. Recently, reports have shown that probiotics help treat constipation by increasing the frequency of bowel movements and improving stool consistency. Add probiotics to your diet and try taking probiotic foods. Probiotic foods include yogurt, pickled cabbage. Treatment of infants and children. If an infant who does not yet eat solid food develops constipation, giving more water between breastfeeding appointments is the first method of treating constipation. If the baby is breastfeeding, the milk should be given to the baby as ordered on the can and not diluted. It is also possible to gently shake the baby's legs with bicycle movement or massage his abdomen carefully to stimulate the bowel. If a child who eats solid food is constipated, he or she should be given more water or diluted juice and encouraged to eat fruit, in puree or in pieces depending on the child's ability to chew. But if the child continues to suffer from the disease after making these changes to the diet, it is likely that the doctor will prescribe lamination. Lectins are often prescribed alongside beneficial foods for children to treat constipation. Osmotic lamebs are usually tested first and then, if necessary, stimulators. In addition to eating fruit, children at older ages should follow a balanced diet containing vegetables and whole grain foods such as pasta and wholemeal bread. Sesame. Sesame seeds make a great home remedy for constipation, according to a study published in the International Journal of Research in Applied Science and Engineering Technology. The oily blend of sesame seeds works to moisturize the gut, which can help you if you have problems with dry stools. Add sesame seeds to cereals or salads to relieve immediate constipation. Orange. Oranges can help you a lot in this regard. Oranges have plenty of vitamin C, which helps soften stools, has fiber that contributes to the volume of stool grit, and also contains a flavonoid called naringenin, which researchers say acts like laxatives. Use oranges as snacks or in salads. Fresh lemon. One of the simple ways to fix this complication is to drain lemon juice into lukewarm water. It should be noted that you can add a pinch of salt, half a teaspoon, and a tablespoon of honey to your lemon juice. This drink has the greatest impact when you drink it on an empty stomach. Try this process for at least a week. Fig. Fig constipation is one of the miraculous fruits in the treatment of constipation. You can soak 3 or 4 almonds with dried figs in water for a few hours and mix or beat together after a little softening. Add a teaspoon of honey to this mixture and eat it. Raspberry. Raspberries are one of the foods rich in fiber, and each cup has about 8 grams of fiber, that's equal to strawberry fiber. Fiber increases the volume of your stool to help the food move smoothly along the digestive pathway. In addition, fiber nourishes bacteria within the intestines for optimal digestion. Treatment of severe constipation with baking soda. The therapeutic effects of baking soda on this disease are extraordinary because the bicarbonate in baking soda removes toxins and the body's wind and relieves the pain caused by it. Baking soda also acidifies the stomach and helps to remove waste from the body. Dissolve 1 teaspoon of baking soda in 1/4 cup warm water and eat. Treatment of severe constipation with Descurania Sophia. One of the quick and effective treatment strategies is the use of Descurania Sophia, which increases the body's water and gentle nature and facilitates bowel movements. For this purpose, it is enough to soak some Descurania for 15 minutes and rinse well, then heat it with warm water to boil. You can add sugar or candy to it and eat it. Edible fibers. Fiber acts like a digestive system cleaner, cleaning fibers, food and waste particles of the digestive system. Eat 20 to 35 grams of fiber per day. Foods with a lot of fiber include whole grains, beans, lentils, oatmeal, almonds, oats, many vegetables and fresh and dried fruits. All of these can be home remedies for constipation. Dried plums, plum sheet. Dried plums and plum juice are one of the natural methods for treating constipation. In addition to having fiber, dried plums contain a natural lameth called sorbitol. Sorbitol is an alcoholic sugar that has a lag effect. Studies have shown that dried plums are more effective than fiber. If you have constipation, dried plums are the easiest natural way to treat the disease. It is recommended to take about 50 grams, 7 medium dried plums, twice a day. Recently, reports have shown that probiotics help treat constipation by increasing the frequency of bowel movements and improving stool consistency. Add probiotics to your diet and try taking probiotic foods. Probiotic foods include yogurt, pickled cabbage. Taking probiotic foods or probiotic supplements. Probiotics help prevent chronic constipation. In people with chronic constipation, the balance of gut bacteria disappears. Probiotic foods can help keep gut bacteria balanced and prevent constipation. Probiotics help treat constipation by producing lactic acid and short-chain fatty acids. These substances improve bowel movements and make defecation easier. Coffee consumption, especially caffeinated coffee. For some people, coffee can increase the desire to go to the bathroom because coffee stimulates muscles in the digestive system. In fact, one of the studies showed that caffeinated coffee the size of a meal can stimulate the gut. The effect of caffeinated coffee is 60% greater than drinking water and 23% more than caffeine-free coffee. Coffee contains a small amount of soluble fibers that prevent constipation by keeping the gut bacteria balanced. The effect of drinking water on constipation and exercise. Your digestive system needs water to help you wash materials in the gut and move better. As a result, we recommend drinking 8 to 10 glasses of water, adult men and women, and 6 to 8 glasses, children, a day. Exercising helps your digestive system muscles work better, so solids can move more easily. Try to be active every day of the week. Your doctor may also recommend certain exercises. Fit fiber in the diet. Fill your plate with plenty of vegetables, fruits and whole grains, and don't use high-fiber foods such as dairy and meat. Nutritions that contain sufficient fiber are vegetables, fruits and whole grains, and low-fiber foods include dairy and meat. Castor oil. This oil is commonly used to treat severe constipation. In this way, the affected person should drink 1 or 2 teaspoons of castor oil on an empty stomach. You can use juices such as orange juice to improve the taste of the oil along with it. A few hours after use, you will notice the effect. It is necessary to know that this oil has strong medicinal properties and should not be used for a long time, because it can have side effects. What is normal bowel function? It is the duty of the intestine and rectum colon to remove water and certain electrolytes from the stool and then to keep it before excretion. The term, normal, can have a very large meaning, but in general, acceptance must occur at least once every 3 days, not more than 3 times a day. The stool should be easily excreted and does not require too much pressure, and at the end of the day, the person should feel completely evacuated after responding. The belief that every day's acceptance is necessary is not true at all, leading to futile concerns and excessive laxative use. Cause of constipation. Not eating enough fiber, such as fruit, vegetables and cereals. Don't drink enough fluids. insufficient mobility and long periods of time sitting or lying in bed, dehydration. Diseases such as diabetes, hypothyroidism, scleroderma, lupus and depression. Drugs such as drugs, blood pressure medications and sedatives. Postponement of disposal action. Change your diet or daily schedule. A side effect of the drug: stress, anxiety or depression. Constipation is also common during pregnancy and up to 6 weeks after delivery, and intestinal diseases. People in older ages, 65 and over, have slower metabolism due to their slight tendency to perform physical activities, and muscle contraction power along the gastrointestinal tract is lower than younger ones. In this way, older people are more likely to develop constipation. Women are more likely to be infected than men. Pregnant women are more susceptible to constipation during pregnancy and after childbirth due to changes in hormones. The presence of a baby inside the uterus causes special pressure to the intestines and slows down the excretion process. Symptoms of constipation. If you have any of the following symptoms, you may be constipated and need to consult your doctor and treat constipation. If you have been constipated for more than 3 weeks, sees blood in his stool. You have abdominal pain. You feel pain during bowel movements. Gradually you become underweight and thin. You have sudden changes in bowel movements. Treatment in pregnancy and lactation. There are safety procedures for treating constipation in pregnancy that pose no risk to the mother or baby. The GP will first ask the mother to consume more fiber and fluids and exercise mildly. But if the change in lifestyle and diet was not effective, Lactation is prescribed for regular and easy excretion of feces. Most laments are safe for pregnant women because they are not absorbed by the gastrointestinal tract. So these drugs won't have a side effect on the baby. Hemorrhoids. Hemorrhoids are one of the most common complications of severe constipation and can cause a lot of pain and discomfort for sufferers. When the vessels in the wall are damaged and inflammation due to the passage of hard stools, you have hemorrhoids. To prevent this complication, you must adequate fluid intake, use of foods high in fiber, mobility, avoiding straining during disposal, use a spa bath, surgery. If your constipation doesn't get better with other treatments, surgery may be an option. But it depends on what's causing your problem. If you have intestinal obstruction, rectum drooping, part of the rectum protruding outside your body, or fissure, small ruptures in the anus, surgery can help, because it can repair these problems. Also, if your constipation is caused by a part of the colon that doesn't work as it should, you may need surgery to remove the area. Golden tip. Use olives and olive oil a lot to prevent constipation and to treat constipation.